Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, let me introduce myself. My name is Reny Deswita. Thanks for the opportunity that given to me to be able to present this poster of the study entitled Factors Associated with Insomnia Among End-Stage Kidney Disease Patients Who Undergoing Hemodialysis. I am the first author and I have two co-authors, namely Lestari Sukmarini and Imade Karyasa. Both of them are my supervisor at the Faculty of Nursing, University of Indonesia. This poster is divided into a six-part: background, method, aim and objective, result, conclusion, and reference. Okay, let's take a look at the background. Insomnia is commonly occur in end-stage kidney disease patients who undergoing hemodialysis. Insomnia has negative impact on physical, social, psychological aspects and furthermore can cause death threats in those patients. There are various factors related to insomnia in this population, which are biological, psychological, lifestyle, and dialysis. The management of insomnia is unlikely to be successful for a long period of time without addressing the underlying factors. Because of that, research on the factors that contribute to insomnia needs to be done. In this study, the factors studied were muscle cramp, pain, comorbidities, stress level, coping strategies, and adequacy of hemodialysis. And for the method of this study is cross-sectional design. Recruited 105 patients who undergoing hemodialysis, selected by consecutive sampling technique that choose patients who qualify the inclusion criteria. These are patients who undergoing hemodialysis 2 until 3 times per week, age more or equal 18 years, duration of hemodialysis more or equal 3 months, stable hemodynamic status, able to communicate, data collection held in hemodialysis unit of Dr. Esnawan Antariksa Air Force Hospital in November 2018. Insomnia was evaluated by using the Minimal Insomnia Symptom Scale. To ascertain the inclusion criteria for frequency, duration of hemodialysis, and age, I used the data that available in the hemodialysis unit, and for the criteria for stable hemodynamic status, we can see from the clinical condition and status on the monitor. And for the purpose of the study is to identify the factors associated with insomnia among end-stage kidney disease patients who undergoing hemodialysis. And for the result, based on bifariate analysis, show that the muscle cramps factor was significantly associated with insomnia with p-value 0.047, with severe muscle cramp has the OR 0.510. It means that patients end-stage kidney disease who undergoing hemodialysis whom have severe muscle cramp have reached about 0.510 times to have insomnia, while the moderate muscle cramp has OR about 0.268. And for the pain factor was significantly associated with insomnia with p-value 0.034, with severe pain had the OR 5.47 and the moderate pain 2.825. And for the comorbidities factor, were not significantly associated with insomnia with p-value 0.397 as well as the hemodialysis adequacy factor with p-value 0.571. And sleep hygiene factor was significantly associated with insomnia with p-value 0.018 and the OR value of 3.226. Stress level factor has a significant associated with insomnia with p-value 0.005, which severe stress has OR 23.33 times to experience insomnia, while moderate stress has risk of 2.463. Coping strategies were significantly associated with insomnia with p-value 0.015 and the OR 0.349. Insomnia was experienced by 51.4% respondents and had significant associated with muscle cramp, pain, stress, sleep hygiene, and coping strategy. And based on logistic regression analysis, we were used to investigate the dominant factor. Coping strategies was the dominant factor associated with insomnia with p-value 0.015 and the OR 2.9. It means that patients with low coping strategies were 2.9 times more likely to experience insomnia than patients with high coping strategies. All these factors have 97% to chance to determine insomnia. And for the conclusion, insomnia had significant associated with muscle cramp, pain, stress, sleep hygiene, coping strategy, but had not significant associated with comorbid hemodialysis adequacy. Coping strategy was the dominant factor associated with insomnia. And this is the several reference that I used to make this poster and this research. And then this is my mobile phone and email. Okay, that's all from me. Thanks for your attention. Assalamualaikum warahmatullahi wabarakatuh.